I absolutely love orthopedic sports medicine, and really what drew me to sports medicine in the first place was being an athlete. I ran track and played soccer. I did both of those up through high school, and then in college I ran track. I was a long jumper. I'm still quite active now, playing recreational soccer and really being out there and staying healthy and fit, and I try to bring that to my practice and my patients. I really take care of a wide range of patients, participating in a variety of activities, kind of recreational athletes, but also higher level club, collegiate, high school, semi-pro and professional athletes, patients that want to get back to doing things that they enjoy, whether that's playing soccer or basketball or it's out gardening or golfing. And so our goal is to really get patients back to doing all of those activities. The conditions and procedures that I do primarily are comprised of shoulder instability, like if there's a shoulder dislocation and needing to repair the labrum, which often is injured in a shoulder dislocation, or rotator cuff injuries, rotator cuff tears, ACL tears, meniscus injuries, kind of really all those things that fall within shoulder and knee primarily. Female athletes are really about 8 times higher risk of sustaining an ACL tear as compared to male athletes, and that's for a lot of different reasons, including anatomic differences, but also biomechanical differences. I really involve patients in the decision-making process. I try to explain to them so that they understand exactly what the condition is and what the options are that we have. I will show x-rays and pictures and just everything that I can to help patients understand. So I think really it's a kind of a team-based approach to the patient's care, that I'm there with them for every step of the way.